Let's talk about testicles. Dwayne "The Rock" Johnson shared that he had a recent testicular cancer scare because he had a painful lump on the back of his testicle. Well, thankfully, he did not have testicular cancer. He had another diagnosis, epididymitis. I'm Dr. Frita, and I'm going to talk to you about testicular cancer and also do a brief overview of epididymitis. So please share this with anyone you know who has testicles. Okay. Let's start off talking about the anatomy, because a lot of you, when you think testicles, you just think balls, like you just have two lumps and hey, that's the whole anatomy. But your testicle is actually the egg-shaped ball that's inside of your scrotal sac. And on the back of each testicle is a tightly wound tube called the epididymis. And the epididymis is responsible for storing, maturing, and transporting sperm. The testicles and the epididymi are surrounded by the scrotum, or the scrotal sac, which is the loose skin. Testicular cancer is actually the most common cancer diagnosed in males between the ages of 15 and 45. It typically presents as a lump on the testicles. Some risk factors for having testicular cancer include an undescended testicle or cryptorchidism. Also, if you have family history, when your physician examines you, a thorough testicular exam can pick up testicular cancer. Also, if you get to know your own body, then you touch on your own testicles. If you feel a lump or something abnormal, that can detect it. I will say that doing self-testicular exams is actually controversial because we have no definitive scientific evidence that doing self-testicular exams actually decreases the death rate from testicular cancer. Either way, we know that doing self-testicular exams won't hurt. Now, the good news about testicular cancer is that there's an excellent survival rate. So if you detect a lump, then please do what Dwayne "The Rock" Johnson did and go to your doctor immediately. When he went to his doctor, he actually was examined, they did an ultrasound, and found that he had epididymitis, which occurs when you get inflammation in the epididymis. Epididymitis is usually caused by a bacterial infection like E. coli. In men who are older than 35, the source is often backed up infected urine or infected sperm. You can get epididymitis from sexually transmitted infections, but not necessarily. If the cause is from a bacterial infection, then a course of antibiotics will treat it most of the time. Had you heard of epididymitis before hearing this story? Please comment. And to continue this conversation with me live, join me for my live stream, Dr. Frita Live, on Monday at noon Eastern Standard Time. We discuss the latest trending medical headlines and celebrity health news.